Dental practitioners play a key role in shaping a child's earliest experiences of the dental visit. By creating a positive, non-threatening environment, children will develop confidence and a high degree of comfort, helping to ensure positive experiences across their lifetime of dental care. In this program, you will learn about the psychological factors influencing a child's behaviour, learn some of the skills and qualities necessary to successfully treat a preschool-aged child, and take a look at a selection of case studies to identify the structure of a successful dental consultation. Child behaviour changes in relation to age and psychological development. Children younger than 2 years old have little ability to interpret verbal contact, making effective communication difficult. Rapport with an infant can be developed through non-verbal communication approaches. An oral examination and some treatment can be accomplished without sedation. 2-year-old children have limited vocabulary. They have a strong need to touch and observe objects, but are usually shy of new people and places. 3-year-old children tend to have a better vocabulary and are generally easier to communicate with. They also tend to feel more secure in the presence of their parents or carers. 4- and 5-year-olds usually listen with interest and respond well to verbal directions. They have lively minds and can be great talkers. Generally, they are cooperative patients who have little fear of leaving their parents and can establish good communication with adults. While these descriptions provide a good general overview, it is important to recognise that each child should be assessed as an individual.
My style does depend on the age of the child that I'm treating. With very little children, we're talking about 1 year to 2 years old, they're not going to interact with you that much. So I talk to both mum and child, and depending on the child, some children are more interactional than others. But when we're getting into the slightly older age group, like the 3-year-old, 4-year-olds, I do talk to them in preference a lot more and ask them questions and really engage in conversation with them. So I would say that's the main style difference between the two groups.
Being an effective communicator is one of the key attributes of a successful oral health practitioner. It is essential to pitch your advice and instructions appropriately to the different age groups you treat. Some of the most important features people look for in an oral health practitioner include a gentle, friendly manner, someone who clearly explains treatment procedures, a practitioner who keeps pain to a minimum by showing care, empathy, support and reassurance, sound technical skills, and a practitioner who is honest and open.
So Lorian, this is what I'm going to do. I've got to put these glasses on, okay? Just like that. And then, have you ever played peekaboo? You know how you play peekaboo? See, you play peekaboo? And I'm still the same. You can see I've just got to put this mask on. And the mask is to stop me breathing over you. So I'm just going to put some gloves on like this, okay? And you've got your bib on, that's really good.
I usually go out and trying to find what their specific interests are. Some kids walk in with a Superman jacket or something. And I totally ignore the dental side of it. I don't say, oh, you're here to see a dentist today.
When communicating with young children, I think one thing that's really important is to keep a cheerful countenance. So to smile a lot and engage them, just be bright and cheerful. Sometimes a tone of voice helps a lot rather than a monotonous tone to sort of go up and down. And if you hear a children's storybook, say, you know, they sort of vary their tone a lot. That catches the kids' attention, I find. Often I try to greet them initially without a mask so they can see that I'm a normal human person. And depends on the kids. Some kids are a bit more outgoing, so you can establish this, oh, look at your Spider-Man shoes, are you Spider-Man? And you know, or you're on a home run if they respond. And some kids just take a little longer to pick up. Maybe you might want to engage a sibling first and say something really simple like, is this your sister? And that's a simple yes or no. They're not put on pressure, put in a bit of a spot to give you a long answer, and then you can build on that.
Effective teamwork and collaboration between the dental assistant and dentist can play an important role in a successful dental consultation with young children. Here we can see the dentist is talking to the parent, while at the same time the dental assistant is ensuring that the child remains engaged and comfortable in the clinic environment.
I think teamwork is really, really important. The DA and the dentist, the dental assistant and the dentist, really have to work very closely together. When you're actually operating, it's very important to know what you're doing. So I actually like to have everything set up beforehand, so the communication or passage of materials between DA and dentist is very quick. But at times when we're talking to the kids, I don't mind my DA jumping in, but it's very important, I find, that only one person talks at a time. So it's either DA or dentist, so the child is not confused with who do I listen to.
Teamwork starts right at the reception. At the minute they arrive at the reception, how the way the receptionist greet them, and then myself and my dental assistant work as a team. When I talk to the parents about some important issues, my dental assistant always keep them occupied, take them away, show them pictures of brushing or something.
There are a number of different stages in a successful dental consultation. In the following segments, we will look at each stage, review examples from a number of case studies, and discuss the techniques that dental practitioners may adopt. It is also essential to recognise the importance of working effectively with parents and carers during the dental visit.
Managing parents during the dental visit is very important. Then again, I always pick up clues from the parents. There might be parents walking in the first time into the dental room and telling the kids, oh, don't worry, it's not going to hurt. Or they walk in and tell me, oh, I have terrible teeth, or I'm terrified with dentist or something. In that case, I usually get my dental assistant to tell them, oh, do you want to take Tony to show them some picture books or something. They take them away a little bit, and then I talk to the parents, explaining what's going to happen. Try not to over-prepare the children before they come in. Just tell them, you know, they're going to see a dentist, and I'll take the responsibility of explaining to the children exactly what's going to happen.
With managing parents during a dental visit, it really does depend on the parent and the child and their relationship. If a parent and child walks in and the child is really clingy, you know, won't let go of mum, then obviously this consultation has to happen really together. If I find that the kid is quite a bit more confident and willing to be separated from mum, that's fine. The kid goes on the chair separately, but mum stays close by, or mum or dad stays close by in viewing range, so the kid still feels comfortable that mum is there, but I'm a big boy going on doing all this by myself, and mum is always there to just hold a hand or touch the leg to just make sure I'm there, and you can see me.
The initial greeting is a crucial moment in the dental visit. It provides the opportunity to create a friendly, welcoming environment for the young patient and helps ensure they are comfortable with the practitioner and their surroundings. Here are a few tips to follow. Introduce yourself to the child first and then to the parent or carer. Include the parents in the conversation, but keep the child central to the developing relationship. For younger children, offering a toy can help to put them at ease. Soft and non-washable toys should be avoided. Avoid abrupt instructions. Remember, the aim is to put the child and parents at ease before proceeding to the next stage.
This is Noah and Lorian.
Hi Lorian, how are you? My name's Hanny.
So shake his hand. Do you know how to do that?
How are you? Good.
Shake. Do you know how to shake hands, Noah?
Noah, how are you?
Oh, that's right.
Come in.
When I'm seeing a child, especially for the first time, I will make it a point to take off my gown and I go outside to get the child into the dental chair rather than the nurse. And what I will do is usually crouch down to their level and say hi. Again, depending on some children a bit quieter, so I might use siblings to help me along. And ask very simple questions and make simple comments like, that's a pretty pink dress. Is pink your favorite color? I like pink too. Things like that, or comment on what they've been just doing, like playing with their doll. You know, does Dolly have any teeth? Let's go check Dolly's teeth. This is a place where we just count people's teeth. So I don't use words like dentist or big words that they may not know or may have heard bad stories about. And then usually I will just talk to the child. I'll briefly introduce myself then to mum or dad and say, hello, my name is Ruth. Then I will walk with the child. If the child's willing, I'll put my hand out. If they hold it, great. If not, that's all right.